What's up, everybody? Welcome to the Performance Medicine Show. This is where we answer your health and wellness questions. See, we've got some people in here. Welcome in. Donald, what's going on, man? Uh, Goat's milk. Interesting. Okay. That's super interesting. Anybody with us, do we remember what Doc said for the one food he would choose? Um, I'm trying to remember what it was, but I'm going to send you that clip, Donald. I'll send you uh, the moment where he's talking about the food that if he was on a desert island, what's the and he can only eat one food, what would it be? I will. Deborah's saying fish. It might be fish. I think it was fish actually. It was some sort of fish. But Dr. Hyman said goat's milk. That's super interesting. Stan saying fish. Okay. Okay, so it seems that Doc said fish. Linda Venn, is that my Swedish name? Great to see you in here. Great to see you, Stan. Deborah, thank you for being in here. Lisa, thank you for sharing as always. Moretta, what's going on? Great to see you. So good to see everybody. Welcome in. Let's see, Roel's here. What's up? Let's see who we got here. Kathy, hello. Great to see you. Jack, what's going on? Great to see everybody in here this Tuesday evening. So glad y'all hang out with us. I don't know if it's cold or warm where you are. It's kind of been both in Knoxville, Tennessee today, where I'm at. Been a little bit of hot, a little bit of cold. Trying to get my steps in. You guys are holding me accountable. I've been a little embarrassed from my step count yesterday, or sorry, not yesterday, last week. Barbara, what's going on? So good to see everybody. As you guys know, we send out Performance Weekly every Tuesday around 3 p.m., well, between 1 and 3, depending on the complexity. But this week's was complex, but also very interesting. And our operations manager, Katie Gegley, is a huge fan of this. She actually helped us out with some of the content here. So thank you, Katie, for doing that. Beef liver, nature's super nutrient. This is what the Common Sense MD episode is on and was the main topic of Performance Weekly today. We've got some fun liver facts for you here in a second that we'll show. But if you guys have not watched that and are interested, make sure you check that out. On Dive Into Diet today, we had Lucas Schmidt, our nutrition coach at all the Performance Medicine locations. He goes over his top 5 favorite foods. It went so deep that we had to do 2 parts. So this is part 1, and next week is part 2. So be sure to be on the lookout for part 2 next week. And I'm looking for, we had an Explain This episode go out. Let's see, it was on choline. I'll look for that here in a second. We'll have to put that up. But the Explain This episode was on choline today. This is one from last week. This is in regards to MTHFR. This was 2 weeks ago. We put this in here because it played a pretty big role in the beef liver episode. So you guys might want a refresher on MTHFR. We think of MTHFR, we talk about it all the time because it's one of the genetic tests on the Cleveland Heart Panel, which you've heard us talk about. And it's pretty deep, man. Robin did such a good job of explaining the complexity of it in a way that you and I can understand. So check that out if you hadn't, and we'll get the choline up here in a second. Katie, yes, beef liver. I told you yesterday. I'm thinking about it. I will for those interested. This is just my own accountability. Y'all are my accountability partners. 8302 so far in this daylight savings time. Might even make it to 10K today. We'll see. You hear that? I see Doc's in the green room. 10K for me today. That's the goal. I'm getting there. Okay, one more thing, guys. If you guys are in Johnson City or Kingsport or Bristol, these guys are incredible. I think they got 1 or 2 spots left. I don't know if we need the link or not. If we do, I'll put it in here. But they're doing free movement screens for performance medicine, and that includes you guys. Even if you're not a patient in an office, you guys come to the show every single Tuesday. So be sure to take advantage of this. There is a link to sign up because they only have a certain number of slots. So be sure to check that out if you haven't. I think there's a link on our Instagram page at the moment. Shout out to TriStar. Jasmine, we're going to do it. We'll do it. We'll do the beef liver testing or tasting at some point. We'll have to. Katie's saying put it in orange juice, and we won't even know it's beef liver. So I think that's what we'll have to do. Is Doc ready to go? All right. What's going on, man?
Hey, Ben. How are you?
I am wonderful. Excited to do another show, man.
Me too. I love the Tuesday night shows.
This is so much fun. I know you have a little pre-show ritual, as do I. I did not get, I usually walk just a little bit, but I didn't get to. I walked earlier in the day. But as you can see, 8,000, it's not bad for me.
That's pretty good. That's pretty good. I bet you end up with 10 before the night's over.
Without even trying?
Probably, yeah.
Yeah. Mm-hmm. I mean, I'll have to, yeah. I'm in the Fountain City location now. I'll have to walk to my car, which I'm doing one of your little practical tips. I'm parking on the furthest parking lot.
Good. So you have about 50 feet to go?
Yeah.
Don't strain yourself tonight.
Yeah, I'm gonna. It's all about sustainability and being able to do this again. Tomorrow. I'm gonna continue to try to make walking a bigger part. What do you think of beef liver today?
That was a good podcast. I certainly ate my raw beef liver today, and I love it. Like Katie said, you just put some orange juice in your mouth, fresh squeezed orange juice, and put half an ounce in there and just swallow it down. It's good.
It is wild how many nutrients are in it. I didn't realize it until the episode today. But it does.
Ernie chews it up raw and savors it. He likes the taste of it raw.
Really?
Yeah, he does.
One thing you mentioned was oysters was probably number 2 on the nutrient dense list of foods.
Yeah, oysters are very good for you.
Super interesting. I see Margot's in here. Margot, I missed you today. I didn't get to get into the Fountain City location. Margot's our PA in Fountain City, and I'm gonna be in the office tomorrow. I promise. So shout out to Margot and Amber. Jasmine's also out of this office here in Fountain City. I see. Oh gosh, Barbara, you don't like the raw beef liver? I can't believe Ernie likes it.
Barbara likes cake. That's what Barbara's favorite thing is, cake.
Barbara does like cake.
I remember that about Barbara. If she was stranded on a desert island, she'd bring cake with her. I'm
going to put this up from Donald. Donald asked last week around, what's the one food that you would take? And he's saying Dr. Hyman chose goat's milk. And I believe everyone here is remembering fish. And I think that's what you said.
I said fish, but that's really interesting.
Goat's
Don,
milk.
I hope you're doing well. Goat's milk. Yeah, that's very nutritious. Wow.
That's interesting, right?
It is. It's just hard to keep it refrigerated on a desert island, but,
super
maybe Dr. Hyman had a goat on there, and just get it fresh from the goat.
Look at Roel. Guys, check this out. 30,000 steps today. It's okay. He's a letter carrier, but dang, that's incredible. 30,000.
That is amazing. No wonder you're in such good shape.
That's unbelievable.
This is interesting, Roel, because my grandfather was a letter carrier, and he didn't like it being called mailman.
Interesting.
It's letter carrier. Remember that.
That's awesome.
It's a great occupation. That's a great. It really is. It's a great job. You get to do a lot of walking, socializing. You get outside. It's a great job.
And I believe Roel is in Texas, so I don't know what the weather is like down there right now. But hopefully it was a beautiful day for you. We've had I think the range in Tennessee was like 29 to 61 today.
We had a good walk at lunch, and I took one after work. So I'd love to get out on my bike. That's my true passion. Besides guitar, the
I was about
bike
to
is
say,
my
come on,
passion.
man. I thought you were,
Yeah, you can see
rock
all
and
my
roller.
guitars back there, can't you?
I can.
Two of
I
them.
mean, I know your
Two of 'em.
passion for guitar,
Yeah.
but also you do love the bike. My brother Steve's in the building. Brother Steve, what's going on, man? Great to see you. As always, Steve from Digest Shield. So good to see you. All right, let's get into some questions, man. We got some great questions that came in throughout the week. Oh, there it is. Choline. This episode of Explain This was on choline. And I think we talked a lot about where you get choline from. Super cool episode. If you're interested in choline, check that Explain This episode out with the star of the show, Robin Riddle. Robin Riddle, if you don't know, is out of our West Knoxville office. So shout out to her. Shout out to this episode. Explain This is so cool. What a fun show that is. I learned something new every single time. The MTHFR one was deep, was it not?
It was a very good one. Yeah, deep, but yet she explained it in a great
it was like
way.
In depth but very understandable. So check out both those episodes, guys, if you have not already. All right, let's jump into it. This one is about hair thinning. What is the difference in taking low dose finasteride versus oral minoxidil for hair thinning?
Well, those are two different medicines, and they both work for hair loss. They just work in different ways. Finasteride does two things. It shrinks your prostate and helps you grow hair on your head. It's a DHT blocker. It's a lot more potent than something like saw palmetto. Again, they work in two different ways. So that blocks down DHT, which causes hair loss, and minoxidil, which is Rogaine. It's a blood pressure medicine that somehow they found that it grew hair. I don't even think anybody really knows why, but it turns out it works better orally than it does topically. Plus, nobody wants to put that greasy stuff on their head every day, once or twice a day. So, and the oral works just as well. I take both of them, just for prevention of hair loss. They're very safe. You don't want to take finasteride if you're a woman of childbearing age and could get pregnant. That's the only caveat with that one. But, it's very safe. And the cheapest way to do it is get a 5 milligram generic Proscar tablet and cut it into fourths. So it's real cheap. It's just a cheaper way to do it than getting the 1 milligram finasteride tablets are kind of expensive. So it's very cheap. And they're both very effective, I think. And they prevent hair loss. They grow a little bit of hair back as well. So yeah, they just work in different ways. You can take both of them. I do. I think even Andy takes them. Andy takes them for sure.
And
he wants a thick head of hair, and he has it.
Andy has great hair. He's got some really thick hair, and he's taking it.
He is. Yeah. Andy and I had a good discussion today about who do you trust in medicine? And because I had a really interesting patient that she was told, not to take hormone cream because she had had a brain bleed a few years ago, and they didn't know why she bled in the brain. They presumed it may be autoimmune, but anyway, so her rheumatologist told her, don't take that hormone because it could cause strokes, which is wrong. But again, we just had a great discussion about who do you trust, because really medicine is opinions. There's a lot we know about medicine. There's much more we don't know in medicine. So we got into a real good discussion on, well, who do you believe? And so I told Andy about that interaction after work. We got on the phone talking about another patient, and I go, "That's a really good question because it's all opinion." In my opinion, you should um, do your own research, talk to different people, get different opinions, and go with your gut feeling about how you think it's going to affect you. In the end, it's going to be your decision. Um, and you'll get a good feel about where you feel comfortable. Um, but because may have one doctor telling you not to do it, another doctor tell you it's fine to do it.
Yeah.
But I go with experience usually. Um, and anyway, so I told Andy about it, and he says, "I'll tell you how you trust a doctor." This relates into hair and appearances. I go, "How?" And he goes, "Just take a look at them. If they're fat and they're giving you any medical advice, ignore it. You know, if they're hobbled, limping around, looking 90 years old when they're 60, or, he goes, just look at them and you can tell the difference. If they set a good example in their own personal life, then, you're more likely to trust them." I thought that's just really interesting.
Yeah, I think that whole discussion is interesting, and ultimately, it is up to the patient. And I never really thought about how medicine is opinions,
Mhm.
and I think it's hard navigating this healthcare landscape because you're going to different specialists. You've got you go to different people for different things, and everybody has different. You're hearing a bunch of different stuff, and I think I've heard you talk a lot about how that's kind of how people end up on 10 different
Yeah.
medications and have no idea why they're on them.
That's a good point. Another way I think you can make a decision on who to trust is get a feel if they're listening to you. First of all, are they really listening to you? And are they looking at why? Are they just reacting and making a rash judgment? Here's what you got. Here's your pill. Don't you kind of want to know why? Sometimes we have no other explanation than you have bad luck, but so there's a lot of things that go into, making your judgment based on several different things. I think experience and treating a lot of people and seeing a lot of things helps. But I think I'll do a podcast on who do you trust in medicine. Um, I told you before about one of my patients. We got into a similar talk about um, where do us doctors learn all this stuff? How do we possibly keep up with all this stuff? So I told her how I kept up with it, constantly studying, reading, researching, observing. And so she asked her family doc, who's about my age, has a lot of experience, "How do you keep up with this stuff?" And you know what he said, which is a very honest answer: the drug reps. That's a very honest answer, but it's kind of a sad commentary. If the drug reps can be helpful, but if you're relying on the drug reps or a salesman to tell you how to practice medicine, then you're in a bad spot. And
I
that's
mean,
probably the way most of them do. I mean, you don't practice medicine like you did 20, 30 years ago. I don't practice anything like I did back then. Don't use the same medicines. Don't approach it the same way. So just interesting commentary. I know we need to get to the questions, but just side note.
well, I mean, the show and movie, sorry, the show and book Dope Sick was a great example of how doctors are getting their information from drug reps, and how that spread with some of those pain
Great
medications.
point. Yeah.
Um, so
Yeah.
my assumption is that patients are becoming more and more aware. So again, what we like to do in this show is really encourage people to take ownership of their health, and like you said, do your own research, figure out a few people to listen to, and then ask questions if somebody is going to, if a provider is going to put you on a medication. There's no problem in asking why. It's a great conversation.
It's good to be a healthy skeptic, in my opinion.
Yeah.
Doctors kind of skeptical, and I am too. I'm more of an open skeptic, but you need to be a little skeptical of a lot of things. But anyway, that's just my 2 cents worth on that. I'm going to do a podcast on that. Who do you trust in medicine?
I like that. All right, let's get to this one right here. Should tremors, parentheses, shaking, be a concern for men? This came on Instagram. Thank you guys for hanging out with us over there. What's your thoughts on this? And tremor, the way I kind of think of it is your hands shaking. Is there other types of tremors?
Yeah, I mean, your head could shake. You could shake all over. But yeah, I mean, definitely should be looked into. Most tremors, it doesn't matter if you're a man or a woman. I mean, you can both have tremors. A lot of times, most of the time, if it's just that type of thing, hands or head, it's usually benign essential tremor, sometimes inherited, and it's not of any major consequence except you may think you have Parkinson's or something. But you definitely need to sort it out. It should be a concern because you want to make sure nothing else is going on, like Parkinson's. And we see a lot of Parkinson's. There's a lot more Parkinson's now than there used to be. It's a tremendous amount of people that have Parkinson's. It's just like an epidemic, in my opinion. But and maybe some of it's from the COVID fallout. But yeah, I mean, it can be treated too. A lot of times we use medicines to treat it, but you want to make sure there's nothing worse than a benign essential tremor, which is the usual cause of it. But yeah, I mean, I would definitely, something new is going on, and if when your parents had the same tremor and it's just mild, it's probably nothing other than reassurance that you need. But yeah. Say it could be a concern.
All right. Thank you for that question. Let's get into this one right here. Could you please comment on the wheat zoomer and the MRT food sensitivity blood tests? In your opinion, are they useful tests? And I don't know if I've heard of the wheat zoomer. What's your thoughts on this?
Yeah, I've heard of both these. I haven't used them, so I don't know, how accurate. They claim they're pretty accurate. We do a Dunwoody food sensitivity test, which is probably about like the MRT, which is, it's a delayed food sensitivity test that where they use white blood cells and they put a bunch of different types of food in I guess it's in a petri dish or somewhere with the white blood cells. And if they react, I think they put out mediators or something, and if they react to certain things, that may mean you have a delayed food sensitivity to that food. And the wheat zoomer, I think, is a little bit different. I'm pretty sure. I've never used it. I have heard of it. I think it's, more of a functional clinic that puts that out. But it's I'm pretty sure it detects gluten allergies and wheat allergies, which are very closely related, not exactly the same thing, but I think they use not white blood cells, but maybe peptides as a media on that. I haven't used it, so I'm not real familiar. I can't, without experience in using it, I can't really tell you how accurate they are. They claim that the wheat zoomer, that there's a corn zoomer, a dairy zoomer, so they test for different types of foods, I'm pretty sure. But it probably gives you an idea about leaky gut, intestinal permeability, that type thing. So, I mean, I'm not against it at all. If you decide to get it, let me know what you think about it, and I'll look into it more. But
super interesting. I love when some of these new tests come out, come on the show here, kind of gets our wheels turning, things we need to look more into. So thank you for sending that question. And like Doc said, if you get some experience, or if anybody in here with us on the live show has any experience with either one of those, let us know what you think. Super, super interesting. This is a common question we're getting, not only on social, but also inside of the office. Ozempic or Mounjaro, which one is your preference for weight loss? We've talked a lot about the GLP-1 receptor agonists. What would be your preference? I know a lot of it is around insurance and, who's covered and who's not. And then if semaglutides, there's lots of different options for this. So it seems the question is between Ozempic or Mounjaro. And I think coverage is kind of similarly difficult.
Similarly, I don't know. That's a hard one to pronounce.
Similarly difficult.
I love them both. Basically it's whoever your insurance, if your insurance is going to cover it, that you can get. Again, Ozempic is labeled for diabetics. Wegovy, which is the same thing, is labeled for weight loss. So Mounjaro works great too. It has a little extra ingredient besides the GLP-1 inhibitor agonist. It has a GIP, and it seems to pack a little bit more of a punch in some cases. Probably seeing a little better weight loss with the Mounjaro. And sometimes if you get too nauseated on Ozempic or Wegovy, then you try Mounjaro, and it doesn't happen. Not that it can't. Sometimes it does with the Mounjaro, maybe not with Ozempic. So my preference is either one of them that you can get your hands on. They both work great. I mean, to me, that class of medications should be labeled the drug class of this century so far, because it's very cardioprotective. It's just wonderful class of medications. It protects your kidneys. It probably helps non-alcoholic fatty liver disease. It's a true great tool that we have now for weight loss and diabetes. Great. So whichever one you can get your hands on, if you have a side effect of one, try the other one. If you can somehow get a hold of it. The Mounjaro, the problem there is you just can't get a hold of it, unless you got in on early days. Both those companies really screwed up because there's not enough of them. And then insurance companies just don't want to cover them. So it's a toughie. Mm. Half my nurses' days are spent trying to get those things covered. We don't even deal with insurance companies, but we kind of have to for something like that because we want to help the patient out. But interesting. We'll see where that winds up. The folks at Lilly who make Mounjaro are coming out with a weight loss brand of that, just like Ozempic came out with Wegovy. So it'll be really interesting. That's a battle. That's going to be a real battle.
Do you think this is going to be like a battle between these big companies over the next decade, as well as with like compounders? Like, where do you see this going over the next couple of years?
Yeah, I mean, I think so. You can get some compounded, very similar stuff for both those, but I think it's a very good thing, really, to have competition. And in my opinion, I mean, just like the drug reps from the two different companies, I'll see them. They'll bring us pies to eat, to bribe us, and you'll see them out in the parking lot throwing the pies at each other because they're mad at each other, and they don't want to eat the pies because they're on their own drugs, so they're not hungry. So I'm kidding about that. We got very nice reps. Nice reps on both sides. I love them all.
Just
I hope one of them brings us a pie tomorrow. Wouldn't that be something? I don't think they listen to this, but they do. Tune in and bring us a pie.
Yes, we love the reps for both.
They do.
That was super fun.
They're very good. Very good.
Welcome in, everybody. To anyone who's just dropping, I see Motaz just came in. Motaz, what's up, my man? Great to see you as always. I see Penny's question. Steve loves pie, as you know, as do I. I'm seeing here, Ava and Isla love my haircut. Thank you. Goodness. Thank you, guys. Again, I didn't. You didn't say any compliments today on my hair.
I thought you got your hair cut a couple weeks ago.
No, it's been 6 days. But I've been
I do like your hair.
Thank you.
You got that Johnny Depp thing coming out front. Wish my hair looked like that.
Shout out to Ava and Ala. Thank you guys for hanging out with us each Tuesday. So glad to see you guys with Amber. Okay, Terry's in from South Carolina. Welcome in. Thanks, my man, for being with us as always. I see we've got a birthday coming up. Margot Kusturian, our PA in Fountain City's about to have a birthday. Thank you, Jasmine, for putting this in here. And
happy birthday, Margot.
Happy early birthday to Margot. I hope it's the best one ever. Best one ever. Can't wait to see you. I think I might even get to see you on your actual birthday. So looking forward to that. Thank you, Jasmine, for putting that in there. Guys, what do y'all think? What do you think, Bob?
What do you think about what? Oh, you look like your dad. Good. Thank you. That's a good compliment for me. Not for you, but for me, it's a compliment.
No,
thank you, Linda.
That's a compliment for me as well. We need to get Andy in here and see. There is I think a healthy, some people think Andy looks like you. Some people think I look like you. My sister Kelly, of course, looks a whole lot like Mom, but I think we take off of both of you guys pretty evenly. But it's very sweet of you, Linda. Thank you for putting that in there. Kathy, I do too. I love me some Andy. Shout out to Andy Rogers, my brother, over in Johnson City. We got to get more of him.
I would say Andy's probably the most popular person in Johnson City, wouldn't you?
I think so.
It'd be hard to compete with him. It really would.
It's hard. It's really been difficult being his brother all these years. Been difficult in the most beautiful way. Whenever I meet like one of his friends or they say they know Andy, I'm like, let me just preface this. I'm not nearly as cool, but I'm still related. I'm related to him. So that always helps. Thank you, Kathy, for putting that in there. You know what? This is, Carter's up there in popularity over in JC. I completely.
Yeah, but she's more in Elizabeth than the.
Well, this is also true. But when you go into the JC office, everyone's looking for Carter. I've been there and I've seen it. Yeah. So thank you, Katie, for.
She worked with us yesterday, and she was like a superstar.
That is exactly right. She's an absolute superstar. Shout out to Carter.
She looks a lot like Katie too. They look a lot alike. Talk about looking alike.
Let's get into some questions, guys. All right, where are we at? Elena, thank you. That's such a sweet comment. Thank you for being with us.
Thank you. I hope you're feeling good.
Let's see. Where's a question here? I'm looking. Okay, Mary has one on Facebook. Any recommendations for some type of prophylaxis for recurring UTIs? What's your thoughts on this?
Yeah, that's a great question. Yeah. Everybody says cranberry pills, which is pretty good. My newest thing with that is methylene blue. I love methylene blue for recurrent UTIs. Some people have so many they have to take chronically take macrodantin, an antibiotic for it, which you don't seem to get tolerant to. So sometimes it's okay. But me, I'd rather go with methylene blue. It's a little dye. I did a podcast on it if you want to go back and look at it, but do your research on methylene blue for prevention of UTIs. I've heard it said that, when you go into a nursing home, it's mostly women, and a UTI, which they can have no symptoms of, can throw them into the hospital. They can decompensate mentally and physically, and it's because of a UTI. I
Wow.
see that a lot in nursing home patients. So I heard the statement made that not putting every woman in the nursing home or assisted care on methylene blue should be labeled malpractice. But it's also great for cognition. It's great for energy. Look up methylene blue.
Yep.
Really good for that. I love methylene blue.
Mary, if you search for methylene blue and performance medicine, that video will show up. He goes into just dosing the whole deal. And there's certain types of methylene blue that you're wanting to get, but I do think it's over the counter, isn't it?
Yeah.
I think it's a, I think you can find it on Amazon.
You can.
Yep. Thank you for that. Mary, if you guys got questions for Dr. Rogers, this is the part of the show where we answer live questions. So go ahead and put those in the comments here. Let me see if I can search through here. If we got a question. Here we go from Mark. State Medicaid programs are vigorously enforcing limits on the number of Medicaid patients any provider can see. It's illegal for providers participating in Medicaid to take private pay or out-of-pocket payment from any Medicaid member. What options are left for Medicaid members needing health care? That's just super interesting questions. The way I'm interpreting that question is if you're on Medicaid and you can only see a provider who is a Medicaid provider or a Medicaid member, and then the problem is getting access to these providers. Is that the way you're reading it?
Yeah, especially, like a functional medicine doctor like myself, it's tough. I mean, yeah, it's just a shame that, you can't, you're limited in that way. And usually they make it so that you have to see you go to one particular place. In Tennessee, it's called TennCare. But people that can't afford it need medical coverage, of course. So that's where Medicaid comes in. So it's very helpful. Yeah, it's just tough. Doctors have to be careful about what they do because they can get their license jerked for just doing something nice for somebody. It's unbelievable what could happen to you if you say you did violate that and you even gave a free visit to a Medicaid patient. You could actually, the board of medicine could take your license from you. So,
That's a wild scenario. And thank you, Mark, for putting that in there. We've talked a lot about this in regards to like Medicare, which is what I believe you have to go on Medicare once you turn 65. Is that right?
You don't have to, no.
You don't
need
have
to sign up for it. You get penalized later, but you don't have to. You may have other coverage. Many people do. After 65, they still go with their employer coverage.
But there's still, like, when you're choosing a Medicare provider, you have to watch out for like what's covered and what's not, because there's.
Well, yeah, you ought to go back to that episode with Renee where we talk about what kind of Medicare to get on. We talk about the business of medicine quite a bit.
Yeah.
So it's just really interesting, some of the rules that you have to go by. Fortunately for me, being cash only doctor, not connected with any insurance company, somebody could come in and just see me no matter what,
I think
I suppose they could even be on Medicaid and just come in and not tell you. How are you going to know? Who's going to know? How would you know? So that's maybe one option for them.
And
I don't ask people when they come in to see me, are you on Medicaid? I don't know. They're just people. They're not, So
that is interesting. I would imagine, right? I think you and I are both of the belief that more and more people are going to do similar stuff as performance medicine is doing, kind of the cash only, you know, not being associated with insurance companies. So hopefully that helps with this sort of problem
Yeah, it's really
as well.
freeing not to have to deal with insurance companies. We have to deal with them a little bit like on the Ozempic, Mounjaro prior approvals occasionally, but you know, it's just really freeing because you don't have to have an EMR. Uh, it's just so much better. You have more time to spend with a patient. You don't have to search for codes, and the way they've done medicine is just really taken the freedom and choice out of doctors' hands. And half your visits, if you have to work in that system, which most do, 99% of them do have to work in that system. It's 99% of your visits taken up by them typing on a computer, not even looking at you, trying to find a code and trying to document everything in the world about that visit, even stuff they didn't really even ask you, and to get reimbursed for it. And I could give you a lesson on the business of medicine, and I do talk about it quite a bit in some of my
Well, I
podcasts.
think it's important for patients to understand, what happens on the back end in all these different scenarios, because it helps you make informed choices. I see Penny's got a question. I'm going to get to her question, and I want to talk to you more about that because I think it's going to be more and more important as we move forward. Penny's asking, are peptides safe to take? What's your thoughts on this? We talked a little bit about
Yeah.
CJC and CJC 1295 and BPC 157 last week.
Ipamorelin, Samorelin. Yeah, we use a lot of peptides. Yeah, they're safe if you get them from a reputable place. Now, you could probably go on there and order it from China or India and get them illegally, from there. But I definitely wouldn't do that because most of them are injectables. You don't know the sterility of it, and you don't know the potency of it. One time, I had a patient years ago that had ordered human growth hormone from Mexico, and they didn't think it was doing them any good. So they brought it to me and said, "Can you test this to see if this is real human growth hormone?" And at the time, I knew a pharmacist who had a machine that would do that, a mass spectrometer, a very expensive machine. And so I took it to him, and it wasn't HGH, growth hormone at all. It was HCG, totally different type of thing, totally different peptide. So just don't order it illegally and on your own. It's because peptides are really labeled as research, or most ones you're talking about is research vehicles. Now, insulin's a peptide too, so it's safe. But I feel very comfortable with what we are able to order from a legitimate U.S. company that has to follow all the rules. So, but as long as you do that, yeah, they're safe.
It looks like Penny's gotten one from the pharmacy in Knoxville from Robin there. Okay, perfect.
Yeah.
Perfect.
You're getting it from a legitimate place.
Yeah.
If you have a lot of allergies, I told a patient this today. Some people really, really get paranoid about medications, starting new medicine, especially if they've had a reaction, to a previous medication, say an anaphylactic reaction, like I did one time. Scary as all get out. But so I told that patient today, bring it in. And this was just a Nurtec. They were scared to take it because they'd taken an Imitrex and had kind of a bad time with it. And Nurtec for migraines has no relation to Imitrex, but she wouldn't take it, even though she has severe migraines, because she was scared. So I said, bring it into next time you get a migraine, bring it into my office and take it while you sit in my lobby. And just, because I'll be right there if you need me, right outside the lobby. And a lot of times people do that. And, and they say, hey, this is fine. So don't shortchange yourself and not thinking you can't take it. But I rarely see any kind of reaction from peptides.
That's super interesting. Penny, thank you so much for putting that question in. We're going to talk more and more about peptides because they're incredible. We've done a couple different episodes with Robin on peptides, and what's interesting is it seems like there's a use for a peptide for almost anything, it seems, and they're just targeted at different things. So it's cool. We'll talk more and more about that. So I think we've got one on ipamorelin coming out. I'm going to put this up here from Lisa, and then I'm going to get to your question, Lisa. She's going to fall broken neck, C1C2 on the right side as a result of my fall. Okay.
I'm
Okay,
glad.
we're going to keep.
I was worried about you. I was really worried when you told me that. I go, you need to see a neurosurgeon. And the next day, right after you said that, a patient of mine called and had fallen in the middle of the night and hurt his neck, and he couldn't bend it, and he wanted me to call him in a muscle relaxer. And I said, you really need to come in and let us look at that. And so Ernie looked at him first, and I looked at him, and Ernie goes, you need an MRI. So we sent him for a stat MRI. The radiologist calls us and says, this guy needs to be in the hospital right now. He had a hangman's fracture
Wow.
of C2. So you don't take that lightly. So I'm glad you came out of it okay. And just make sure you're seeing somebody that takes care of that type thing. It doesn't always need surgery, but you sure don't want to risk paralysis or, chronic nerve damage because of that. That's the neck area is so fragile.
Yeah.
I'm glad you're doing better.
Thank you for keeping us updated, Lisa. We're going to continue to pray for you in your recovery. I'm going to put Lisa's question up here because it's one that I think can help a lot of people. What is the daily dosage of zinc to take that won't make you nauseous? I know what I think you're going to say, but go ahead.
Well, of course, any bit of zinc can make you nauseous if you take it on an empty stomach. So make sure you take it with food. And for people, the usual dose is 50 milligram, but for people that get pretty nauseated, they can usually tolerate 30 milligram, which is fine. Just make sure you take it with food. And you can usually tolerate a 30 milligram. It makes me nauseated too when I take a 50.
And when you say take within the hour, within 30,
or with it while something's on your stomach.
All right. Hope that
Great
helps,
question.
Lisa. Thank you for putting that in there. I'm going to put this up from Carol. This is something we see. We're seeing this every day. It's it's frustrating. I know it's frustrating, on our staff who deals with a lot of this. It's
call us and we can get some compounded of either one of them. It's very similar. We've had good luck with it. Way cheaper.
The compounded is called semaglutide. Let's get this in from Janet. Having past history of colorectal cancer, now bladder retention, should this be a concern? What's your thoughts on this?
Yeah, that needs checking out. You really need to check that out. You need to see a urologist. Sometimes there can be a fistula, hopefully it's not, but I wouldn't ignore bladder retention. See your local urologist, and they can just make sure that nothing's going on there.
Thank you for that question, Janet. Keep us posted on how everything's going there. I'm looking for questions here. If I'm missing somebody, let me know. D-Len, thank you for being here. Let's see here if I'm missing somebody. If you guys have questions for Doc, go ahead and put it in the comments. I should see the latest stuff. I'm getting lost in the shuffle here, guys. Okay, I don't think I missed anybody. What's been top of mind for you? Beef liver?
Me? Yeah, I love beef liver. Probably the most. I wouldn't say I love the taste of it, but it's a very super nutrient, probably the best there is. Oh, I'm glad you love the podcast of that, Motaz. Yeah, isn't that interesting? Get you if you eat the raw stuff, get a good source, which I found at a local butcher shop. I'm glad you like that podcast. Yeah, I was really pumped up about getting that, and I'll have to give Katie the credit. She was
Yeah.
really on board early with some of Dr. Salandino's work. Matter of fact, she'd probably, if she had the opportunity, she'd probably go work for him instead of me. But I hope she doesn't. I sure hope she doesn't.
Katie, stay. I love it. I love it. Thank you guys for putting that in here. Let's see. Penny's asking, I'm dealing with elevated IgA. Is that from SIBO and the leaky gut that I have?
Definitely could be. Yep. I would say you're probably right. I'll tell you what, talk to Robin Riddle, our amazing nurse practitioner who deals with gut stuff every day. She helped my gut a lot, post-COVID gut. But yeah, it's complex. There's a lot of, hopefully you can get you've gotten a GI map, or something similar and are dealing with it. Robin even has a SIBO test in the office you can do, rather than having to go to the hospital and get it. But yeah, that leaky gut can be fixed.
Yep. Penny, we have a podcast with Robin on SIBO in particular. If you search for SIBO and Robin Riddle, that will definitely come up. Thank you, Penny, for that. See, Dr. Rogers over Dr. Saladino. Am I right, guys? Dr. Rogers over Dr.
I don't know. He's famous.
I love it. Thank you, Katie. That's so sweet. And I'm going to put this up. Ben Curtis, shout out to Ben.
Yeah, Ben Curtis is.
He's all over it. He is all over it. You can see him. He's in our Kingsport office every once in a while. Does a lot of work with us, and he is super smart around the carnivore, that whole thing. So really interesting. Thank you guys for that. Let's see here. What is the butcher shop? Katie might know.
Gosh, I had a link to there on my thing. I'm blanking out on the name of it. Their farms are local. Gosh, what's the name of that? It's on Bloomingdale Pike here in Kingsport. Katie, flash the name of it up there. I know you know it. Or look at today's podcast because there's a link on there. Starts with an L. Lazy Tea, I think, or no, I think that's what it is.
You know what?
Katie will flash it up there in a minute.
I'm going to put this up from Lisa because Lisa, I've got a few more minutes. Where, the camera's on me.
Let's get Icon. Let's get.
And, I can't have it's Izzy and I taking away my shine, like I knew this was going to happen. Lisa's just, they're all here for Ike and Izzy.
I know, as we wrap the show up, everybody wants it. I will show you a picture. I have it on my screensaver. If this will come through, I got a cute little picture of both of them. They're best friends. I mean, they definitely love each other. And here they are together. You see that? There they are. That's my screensaver.
You know what?
Isn't that a cute one?
Lisa, I totally get it. They have my heart as well.
Look at that.
And whenever I get up to Kingsport, I love hanging out with these two. Look at that. I mean, come on.
Can you get any cuter than that?
How do you even get them to pose like that?
You don't. You just sneak up on them and get a picture of them when they're doing it.
Were they asleep?
They were resting, yeah. Mm-hmm.
Let's get to Kathy.
I thought I heard them coming down here. There's Izzy right there.
Can we get to Kathy's question real quick?
Yeah,
I want to make sure we get this in. Okay. I've been taking high doses of steroids with chemo treatment. I'm really gaining weight. How do I get rid of this weight? I'm assuming this happens a lot with chemo. Is that true?
Yeah, sometimes you do have to. It's tough until you get off those steroids. Mm-hmm. What I would recommend is, like I tell anybody with cancer, there's a couple things I would immediately do. One, I would get on a ketogenic diet. You have to get on a keto diet or something very similar to it. And I'd consider vitamin C, IV vitamin C. But once you get off the steroids, it'll be pretty easy to get off of you. But I really like ketosis for patients with cancer.
I've heard you say that before. I hope that helps, Kathy. We'll certainly be thinking of you.
Yeah.
Think about keto.
You won't be on them for long, hopefully, and you get
Yeah.
off of them and then work on the weight. But, and always listen to your oncologist as well.
Yeah.
Make sure you've got your immune system going, working.
Pop, introduce
she's
the
eating
people who
Oh.
don't know Izzy.
This is Izzy.
That's
She's
the newest edition.
how old is Izzy? How old is it? About 15 weeks old?
No.
2 months? 10 weeks?
11 weeks.
11 weeks old.
Dang, you're a baby.
She's a mini Bernie Doodle, and she's Ike's best friend.
Where's Ike at?
He doesn't want to get on camera. He's a little jealous when I hold Izzy. So
I'm jealous too, Ike.
he'll come. I'll get him on there.
Seems
She's looking for him.
good little tip here from Roel. Mixing small chunks of beef liver with ground beef. That's really interesting.
Great.
Cool.
Yeah, that kind of masks the taste and all.
Yeah.
But yeah, I was just impressed with Ernie today with the way he just chewed up that raw beef liver without he savored it. It looks like he was enjoying it. You know. And if you can't stand the thought of it, then you can get the desiccated capsules. You know, I used to do
Yeah.
that.
Well, apparently, from what Katie said, and you know, I think they got this tip from Dr. Saladino or Ben. You know, the putting in orange juice really does, like, you don't even taste it at all.
Yep. I found that to be very, very good way to do it. There's Ike over here.
Here's Ike, my brother.
We're gonna have to bribe him with a little treat.
Come on,
Here you go.
Ike.
Come here, Ike. Come here. All right, there Ike is. There you go. Here's Ike. He loved that.
That's my brother.
Ike has a
right
big
there.
head, doesn't he? Ike has a really big head.
He's just a big dog. He's a big dog.
He's a big dog.
Let's see, real quick. We're going to try to get this. Deb's asking how much beef liver is a dose? Half an ounce?
Half ounce to an ounce.
Okay.
You know, you could take it 5 days a week. Some people say all you need is 2 or 3 days a week. And you know, if you read about concern of copper toxicity, that's not going to happen with the real stuff. It could happen if you took synthetic copper, but it's not going to happen with the food.
Let me put this. I missed the first part, Motaz. Sorry. Seems that so he was worried about the too much vitamin A.
Yeah. Forget about it. You're not going to do it with the real food. You certainly could if you're taking synthetic forms of vitamin A. Same thing with copper. But I've done some deep dives on it, and I don't think it's ever been seen. Even though if you go to the literature, they're going to scare you into that. Don't take more than once a week or so. But when you eat it, you're not going to overabsorb too much copper or vitamin A.
Katie's saying you can have 1 to 2 ounces. It will not hurt. So thank you for that. Super interesting stuff. The beef liver thing is a really, really hot topic. I'm glad that we're talking about it. I see. Let's see. Sippa and Max, are they barking right now, Linda? That's so funny. Shout out to Sippa and Max.
They're seeing our dogs.
Yeah.
Well, those are some great dogs. Lynn has some great dogs.
Shout out to Sip and Max. Linda, thank you for hanging out with as always. Guys, this has been so much fun. Pop, thank you so much. This has been amazing.
Thank you, Ben. I do like your haircut. Very good.
Thank you. And real quick, happy early birthday to Margot Casturian. Thank you
Yeah,
for
Margot.
being here. I think it's the day before your birthday, so thank you for hanging out as always on the Performance Medicine Show. I cannot wait to see you on your actual birthday. I believe it's tomorrow, but I'll be in the Fountain City office. So happy early birthday. Amber, thank you for bringing in Ava and Isla. Thank you guys for watching the show. Love all you guys. Thank y'all. Carter, love you. Thank you. Thank you, Carter.
Loving the hairband.
See, Montana, what's up, Montana? Great to see you. Great to see you. We got so much of the team in here tonight. Shout out to all the Performance Medicine team here. Y'all do such great work in the office, and to hang out on the show after a long day in the office is just incredible. Thank you. Okay. You're looking good too tonight.
Oh, thank you, Ben. That's the only compliment I've gotten all night. Everybody's talking about you and your hair and all that, and it does look good.
Katie's saying that,
I don't
that
mind.
you look good tonight, and
I do not mind being in the background.
I will confirm it. You look great.
Thank you.
Guys, we're out of here. Thank y'all for hanging out on the Performance Medicine Show. If you're new here, welcome. We'll be back every single Tuesday at 7 answering your health and wellness questions. If you've been a regular on the show, thank you guys so much. We could not do this without you. We love you. We'll see you next week. And I'm looking for my outro. See you, Izzy. See you, Ike. Love you. Love you, Pop.
Love you.
Don't go away.